everyone, welcome back or welcome to my YouTube channel. And today I'm going to be talking about what happens while you're shadowing a doctor. Alright, let's get into it. Okay, so first of all, I'm going to talk about what your day might look like when you're shadowing that doctor. So before you start anything, I want you to open that Google Sheets template I have linked, and you are going to keep track of the number of hours you have shadowed with this doctor. And this is a really good idea because your program might ask you how many hours you shadowed. And even if you aren't asked to keep track, it's also really nice to be able to keep track of it yourself. So when you're putting on college apps or some other things or resumes, it's really nice to have this just with you. And a quick thing about it, you are not allowed to really count lunch break hours because kind of like a job, usually you don't get paid for your lunch break. This is the same thing. You can't really count the hours for your lunch break. And then the next thing I'm going to be talking about is what to do when you first meet. Before you arrive, actually, you want to try to plan to be there at least 10 minutes before. So what you're going to do is put the location in on your phone, and then you're going to select the certain day and the certain time you want to get there. And if you're using Apple Maps, which is what I usually use, it will show you what time you should leave and around what time you'll get there. So then once you get there and you meet the doctor, you want to shake their hand and then also just thank them for letting you shadow again. You want to show how grateful you are. And then after you meet them, you're probably going to go to their office, or if it's not their office, it's more of like a general space area for doctors to work at. You're going to drop your things off, and also just generally when you're walking everywhere with them, you can strike up a conversation, or if you have any questions that you prepared before, you can ask the doctor that. And if you're stuck on what questions you want to ask, you can go after you're approved. Go to the Google document I linked down below, and it's called Questions for the Health Professional You're Shadowing, and it's just a lot of questions in this Google document to ask. There are questions to ask before you go in, so disregard those questions if you're going to ask the doctor while you're walking. But ask some questions for the section called Once You Meet in Person. Yeah, ask those questions and make sure you're actually taking some notes for some of them. So what I did, I basically carried around this notebook 24/7 with me everywhere I went. So what does a typical day look like in the clinic or hospital? Well, for the most of the day, you're just going to be following the doctor around. That's literally what shadowing is. And make sure you're taking good notes. Even if you're not asking a question, if your doctor is having conversations with their patients or even another health professional, you can take notes if you feel like that's appropriate or if it's something you want to remember. So after you stand in the room and the doctor introduces you, they're probably going to ask the patient if they're okay with you staying in there. And you have to be just aware that some patients may not be comfortable with a high school student standing there. And that's totally okay. You kind of have to understand that. And it's probably nothing against you. It's just a lot of them don't expect someone to be there, and usually they expect the doctor. So you'll probably be asked to step outside of the room and just stand and wait there. But most of the times, patients will be okay with you standing there. A lot of them are even happy to see some high school students taking more initiative for it. But the main thing is just not to make sure you're interrupting their conversation. And like I said in the previous video, you want to be like a fly on the wall. So you're still there, but you won't really make yourself super known. So in the clinic, what your day might look like is basically just talking to patients, assessing them, telling them different like complications they might have, just a lot of your typical checkup kind of things. But obviously it depends on every health professional. Okay, for hospital specific, there's a lot of things in this one, but just generally. There usually will be procedures, surgeries, and larger, more equipment-heavy assessments done in the hospital. There might be some checkups at the end, like at the end of a surgery or before a surgery, the doctor might go in to check with the patient. But overall, the hospital setting is a bit more different than the clinical setting. And if you get a doctor who's in both settings, it's really nice to see the difference. And it also is really nice to change up the schedule as well, especially if you're shadowing for multiple days. In general, there will most likely be downtime that isn't like a specified break. So basically, what I mean by this is that the doctor will be sitting at the computer, putting in orders or analyzing like a graph or something. And that's a time for you to either take notes of what they're doing, because the doctor might tell you what they're doing, or you can do some research on the questions you might have had while the doctor was talking to the patient or was explaining something to you, because sometimes the doctor will use vocabulary terms that you might not be really aware of or that you might not really know, and that's okay because you're a high school student. So what you're going to do is just go on Google and search up some of those vocab terms. Okay, the next thing I'm going to be talking about is vocabulary, notes, and homework. And yes, you heard me right, homework. And you might want to assign yourself homework if you really want it to stick in your brain. Okay, so first of all, I'm going to talk about note-taking. So for note-taking, you want to be fast and efficient. So you want to make sure you use abbreviations and symbols whenever you can. So some abbreviations I used very frequently were blood pressure, which was BP, O2, CO2, H2O for all the elements, compounds. And then certain symbols I used was like a magnifying glass, which meant I should search it up if I didn't really know what it was. A question mark for any questions I might have had. The last symbol I really used a lot was just a heart because I shadowed a cardiologist, so I use that a lot. And then here's one thing to keep in mind while taking notes. If you are thinking about writing a thank you card to the doctor, which I do suggest doing, you want to keep track of what you want to put in that thank you card. The homework is just a compiling of all the notes I took that day, or any vocab terms I didn't know that I searched up during downtime. So if you open up one of the 4 resources that I have for shadowing, you'll see that at the top, I have vocab terms that I didn't really understand, and I would go search them up and I would cite the source. And then if you scroll down a bit more, you will see the section called Notes Taken Today. And this is just all of the things I wrote down that day, and I would just write it in a Google Doc because sometimes it's hard to read my handwriting because of how fast I wrote. At the very end of the day, I would take notes of the summary of what I did that shadowing day. And the last section you're going to see on this Google document is homework due. This is the homework I assigned myself to do before the next shadowing day. But yeah, that's really it. So hopefully this video really helped you guys. And the next video will just be about what to do after you shadow the doctor. So I will see you guys there.